Of people today. First, I think Mr. Strickland is on his way. So I believe he will be here. I know that we will not have Dr. Jones here with us. She is out of town. Our chair, Janet Jackson, is still recovering from her back surgery, so she will not be here this week. And I do want to announce before the rest of the agenda, Board Member Thomas did submit his letter of resignation to Chair Jackson and myself last week. So he will not be here this week, and I imagine that we'll have the process for a new board member joining at some point in the near future. All right, so first up for business, approval of minutes from our previous meeting. Have all board members had the opportunity to review the minutes from not last month, but July? Did anyone notice any errors, mistakes, or omissions? No. Can I have a motion to approve our Thank you. Second. All in favor, please say aye. Aye. Any opposed? All right. Our meeting minutes are approved from our July meeting. All right, next up, we will have a CPH and CPD collaboration, read the Right Response Unit and Mobile Crisis Response Team.
My name is Mary. You can go to I have a clicker. Thank you. All right, good afternoon. My name is Marian Stuckey, and this is my colleague, Kareth, and we're going to present on the Mobile Crisis Response Unit and Right Response Units as well. Next slide, please.
See if I get this right.
Oh, you're the clicker.
I'm the clicker.
Okay.
Just to be done. Good.
Okay. Great. Okay. So just to give an overview, Neighborhood Social Services is a division in Columbus Public Health, and we offer services across a continuum. And so that includes all the program areas that you see listed here. So we have programs that focus on social determinants of health. So really looking at those non-health factors that influence health, such as, access to housing, water, food, just general resources that can be connected with. We have a team of social workers that focuses on those resources. We also have alternate public safety, which you'll hear more about just in a moment. That includes right response, MCR, as well as community teams that will be built out in the fall. We have anti-violence programs, which includes the programs listed there, but just really looking at wraparound services for violence and how to prevent different things, as well as community trauma response, which includes a follow-up after there's been an incidence of trauma in the community. So as you can see, again, it's a continuum that helps us really be able to support the community in a variety of ways. We do a lot of collaborations, a lot of referrals to each other, but it's really meant to have a large set of expertise and skills that's within our division area. Okay, next slide. Okay, so the Right Response Unit is one of the areas that we'll be focusing on today. And the Right Response Unit is an innovative program that allowed clinical professionals to be housed in the 911 call center. And so here you'll see some of the goals for the Right Response. So how do we connect residents with support during a crisis, and really looking at who is the right person to respond, and how do we do so in the right amount of time? How do we reduce the reliance on patrol and EMS for crisis situations? So again, matching the skill set with whatever the crisis is at hand. And then just improving community outputs and improving how we can, again, be the most responsive that we need to be. Here recently, we've been able to expand our hours. So we started doing a noon to 4 shift in June of 2021. So we've been able to expand to do a full 8-hour shift, and we're looking to get into second shift as well here in the next several months. All right, here's just also a little bit more about the Right Response Units and the Mobile Crisis Response. It just tells you about the team. So again, Right Response just includes social workers, clinical professionals, and a dispatcher. It talks about our primary response is just being there to take those calls. We really focus on mental health crisis and substance use disorder, and the goals are really to make sure that we're matching that expertise with the call at hand. And then mobile crisis response is next, and Kareth is going to speak all about that, but it includes a multidisciplinary team as well to support the community and to be able to provide that in-person support when a crisis is taking place. So here's actually a slide so Alberta is in the picture as well as Sally. So this shows them taking a call right there in the call center. So we've been able to get acclimated to the dispatch center and just be able to provide services right there, in the center. So a caller would call 911, and they can either self-direct to the right response, or they're directed from the call taker, and it comes back to the right response. The dispatcher will determine if the situation is a mental health crisis, so there's some triage to understand what the needs of the caller is. And then we ask their permission to connect them to right response. So more assessment is taking place, more triaging. The clinicians will immediately provide an assessment and work to stabilize and de-escalate. So they're doing a lot of personal conversations, talking, getting to know the caller, building rapport to be able to get to the core of what the crisis is. And then if needed, we would work to dispatch 911 or a mobile crisis response.
So now we move on to what is MCR. Probably loud enough, I don't need that myself, but I appreciate it. So if I start yelling, everybody tell me, please stop yelling. So MCR is a partnership right now between Columbus Public Health and the Columbus Division of Police. So basically we partner CIT officers with mental health clinicians, and we utilize the embedded co-responder model. What we do with that is assist people who are experiencing any type of behavioral health or substance use crises within the city of Columbus. Also served, see, I told you I'd do that. Also serve the suburbs too, we provide assistance to the suburbs when needed. So the pilot program for MCR began in June 2018, went through 2 pilots, became permanent in August of 2019, and came under the umbrella of Columbus Public Health in December of 2021. Our new teams went live in the cars this year in July of 2022. So it's been super exciting to get MCR continued on. So here's just some statistics that you guys can look at when you want, if you have any questions. This is broken down for the year, last year. Numbers were a little low. We had a couple of units that were out for extended periods of time, but still, grand total of calls for service, including self-initiated events, were 3,535 calls. So we were at least able to take that much off of patrol shoulders and try to provide assistance to that many people within Columbus. This is just kind of shows you heat maps from 2021 to 2022 so far. I thought that'd be interesting too. You see the same spots are basically is where we concentrate. Being only halfway through the year this year, I thought that second heat map was kind of interesting because almost looks like we're surpassing a little bit. So I'll be interested to see how that pans out by the end of the year. And then to date, MCR 2022 statistics, again, dispatch calls and then self-initiated events, excuse me, I can't talk. Self-initiated is when, say, we might be in a car together, we hear a call go out, we're like, hey, we could be of assistance on this run, and we'll attach. So we'll self-initiate. Follow-ups are considered self-initiated phone calls. So they're not necessarily dispatched from the dispatch center. Let's see. So again, statistics, we had a grand total of 1,170 transport to higher levels of care out of the 3,500 and some calls in 2021. So far this year, 605 transports out of 2,120 calls. I saw the city averages about 23,000 mental health calls per year, averaging over the past 3 years. Let's see. Calls for service in which MCR unit responds rarely results in the use of force or arrest, and nobody engaged with MCR to date since June of 2018 has ever been in a deadly force type situation. Let's see. So our officers receive crisis intervention training. They do advanced CIT. We do the International CIT Conference. We also have internal trainings with CPH and other various entities like the ACEs and stuff. Clinicians are licensed, also receive specialized staff development training. So we did DTU with the police, we did legal training, pink slip training. We do one-on-ones weekly. We are also big on the vicarious training and support through that because this kind of job that everybody's doing, yeah, it's needed. It's very helpful. It's very helpful. And then we're big on using debriefing and extra support, processing runs after runs, because some of them are a little rough, to say the least. You know what I mean? So mental health of everybody involved is also important so we can continue doing the work that we're doing. Let's see. So the co-responder model allows for a clinician to be present on scene of the crisis to engage the person in crisis and assess needs. Basically, we're in the cars with the officers, so we are right there. So there, to me, there's no lapse time, like, hey, we got to call somebody to come meet us over here. The clinician is already in the car, ready to rock and roll as soon as we show up on the scene. MCR does have special uniforms, setting them aside from patrol. If you see what, this is kind of the getup that they have. We have like khaki pants and polos. No, I don't have a vest on right now, but CPD did that a while back just to try to look less intimidating and less, to distinguish our unit away from regular patrols. When people show up, sometimes like, are you detectives? No, we're MCR, we're here to help, that's what we're here for. So it's one of the reasons why we changed the uniforms. And the goal has always been and still is to provide compassionate, trauma-informed care as MCR meets people. We see people on their worst days, not their best days, you know what I mean? So we are there to try to help everything we can, de-escalate, stabilize the crisis within the least restrictive environment, which typically would be in the community or at home. Doesn't often end up that way. We push for it, but then we have immediate transport to any of the area hospitals to get somebody like the immediate assistance that they need. Let's see, calls. So like Marion was saying earlier, calls for MCR can come in directly from 911, from dispatch, and sometimes through RRU. RRU will take a phone call, try to do everything they can to de-escalate. They do an amazing job with that, by the way. And then if things aren't able to be de-escalated to the point that we like, they call for us, we respond, see what we can do to give that added, like, on-scene assistance. Let's see. Patrol calls us often, hey, we got this situation, we're a little stuck, do you think you can come help us? Sure, if we're free, we are totally on the way to do that. We get internal referrals, like again, from patrol, sometimes we get it from, detective bureaus, it just depends. We also get external referrals from a lot of the community partners, like say, we'll say Children's Hospital might be like, hey, we've got this incident, for example, with this kid, or OSU, hey, we had somebody leave the hospital, it's not looking good, can you go follow up? We assess levels of acuity, responding to the most acute. So we only have so many units for the city at any given time, so we actually have to kind of triage the board and kind of see what's the most pressing, where can we be the most help. If we've got a potential jumper, we're gonna take that one first, because that's immediate, like right now we have to go. We don't like picking like that, but that's kind of what we need to do with the severity of mental health like these days.
Can I ask you a question?
Sure.
I know that you guys only got so many minutes to do this, but I like to be able to absorb what you're saying.
Yeah.
So can you slow down just a little bit for me?
Sure. Sorry, that's like the Italian in me. I kind of tend to like.
Okay.
So yeah, but for sure thing, I appreciate. So let's see. We are accessible to the public, calling 911 or 645-4545, the police non-emergency number. Let's see, what does that say? Option. So we also wanted to add too, if somebody needs to go get a hold of RRU, if you call 4545, option 3, get you straight to RRU during their hours of operation. There we go. So we just added some testimonials in here. I'll at least read one of them, and the rest we can just kind of look at later, I suppose. But I remember this case. I was on this case too. So Kyle's mom said, we want to thank you for listening to me and never giving up on Kyle. You saved a life, one of many who is suffering with mental illness right now. So continue to do what you are doing. It matters. You all are a very good example of how to execute the first step towards helping the severely mentally ill. So that was really nice. Kyle, we got follow-up emails, and he's actually doing really well. He's still at home where he's supposed to be. Mom's happy, and that's one of the things that helps us continue all doing the work that we do, is when something worked, something followed through and went well. I can leave those other testimonials for you guys. So still evolving what we've learned. So the co-responder model has been beneficial in assisting those in crisis and reducing demands on patrol, because patrol's got enough stuff within the city that's going on that they need to be free to go try to help with those situations, and we try to take the weight off of them by responding to the mental health substance abuse. We do have a limited number, so we only have 5 units citywide. Now with schedules changing recently, all 5 units will be running staggered hours on Wednesdays. Typically, we have 2 to 3 units running anywhere from 10 a.m. to midnight every day, 7 days a week. So we've got the majority of the day staffed. We don't have it 24 hours though. But we are 365 days a year, 7 days a week, holidays, weekends, the whole shebang, we are there. Let's see, where else do we have? So we're also looking at the need for the community response teams to assist with follow-ups after, like, MCR's been able to de-escalate. So RRU will be sending, once we get those teams up and running, we'll be sending some of those referrals for follow-ups, to the community teams. MCR will do the same thing. We do as much follow-up in the time that we can. We also have to work with the immediate, like 911 response, immediate crisis right now. And that pretty much concludes, sorry that I spoke so quickly. So do we have any questions about anything? Yes, ma'am.
I had a question. You mentioned the difference in uniforms for the clinicians. Do the officers who are in that unit also have those different uniforms, or are they, okay.
Yeah. I think their shirts, they're a darker navy, but it's basically this outfit that you see.
Okay. Any other questions for the presenters?
With 5 units citywide, it seems like it's making an impact. Do we know any plans for expansion?
That's fingers crossed, fingers and toes crossed. We've talked about it probably since about the second pilot, if not once we went permanent in 19. Staffing is an issue, you know what I mean? So the numbers are really low out in the city right now. So, but I've heard a lot about expansion. Like, people seem to want it, which is good. We could definitely use it. That would be helpful. Hopefully sooner rather than later. It just kind of depends on what numbers are going to look like and how many officers we can get free to add some more units.
And I would just say that CPH recently brought MCR to CPH. I started in January. So this year, we're really trying to build out and just make sure that we have everything to cover the shifts effectively. And we're also kind of facing some difficult hiring situations now as well with the mental health field. It's just really difficult. So overall, we're looking at just how we can overcome those barriers and how we can just really have a strong first year of the MCR team with us.
I have a question. Even with your limited workforce right now, what is the response from CPD been for having you guys on board with them?
I've not heard, knock on wood, I've not heard any bad things about us. Patrol usually is extremely grateful, you know what I mean? Because we have a little extra, we have some extra expertise and stuff that we can help add to these runs. You know, if you have a example, clear cut, I'm feeling like I'm wanting to hurt myself and I would like to go somewhere, then that's easy. Like anybody, we can just transport straight to the hospital. But when you have some of the grayer cases, you know, like either he said, she said, or like maybe someone's delusional and paranoid, those are where like the mental health aspect kind of really comes into play. So we've been able, I think, to help patrol out a decent amount. They're happy. I wish we could respond more to them, like with the expansion of units. But from what I've heard, knock on wood, like it's been a good response.
So will you do a yearly review on the calendar year? Is that, will you assess how 2022 was successful? And the reason I ask is because I would like to see that at the end of the year. I think all of us would,
Oh,
actually.
yeah.
Definitely. So we do plan to do annual evaluations of the program and look at just general evaluation. So we've talked a lot about that. Potentially, like, external partners would do that, or someone who's highly skilled in that area too. So that's definitely something that we've continued to talk about.
Kind of as a follow-up to that, are there conversations about research and evaluation, kind of comparing the different types of responses, right? So you've got the right responsive unit, and then you've got the mobile crisis response. I know you have different personnel, and I know in other cities they're also talking about, what do you have in situations where it's alternative and there aren't dispatchers along with personnel here. So just want to get a sense of if there's different research or evaluation on the different types of responses, and whether there will be space for switching up personnel given the different circumstance, and if you all are looking at that as well.
Yeah. So like I'm thinking, what I'm hearing from you is like adding like the community response teams, which I'm thinking we're looking at having like a clinician and a peer to kind of take care of like the follow-up stuff. Once we've kind of calmed everything down, then they can go out. We hear peers are doing amazing work along with mental health professionals. We actually just got back from the CIT, the Crisis Intervention International Training, so that was interesting to hear other agencies across the United States and even in Canada. What are you doing? What's working for you? So yeah, that's one of the things we're definitely looking into, is comparing like how is our program versus other programs? What can we tweak? What can we learn from others? What can they learn from us? So yeah, for sure.
And I would add too, like we've done a lot of research too, like building up to this point. So not only are we doing the conferences and things like that, but also we've done a lot of preliminary research to hear about other cities that are doing similar work. and how, like Kara said, there's peer teams, because it is difficult to hire social workers right now. So we have to be innovative in terms of who responds. So there is a lot that's going into that. I would say from everybody that's involved with MCR, we've talked a lot about different acuity levels and how to gauge who is the best responder in those situations. So yes.
Thank you.
So what does success look like to you guys? What does it look like?
It's a good question. I could define that a few different ways, I think. I would like to see us be able to respond to more phone calls, you know what I mean, throughout the city, and be able to provide our assistance to more people in need. It's also when you get that little testimonial from Kyle's mom, that's like, hey, you guys listen to me. He lived in Connecticut, mind you, and like had run away from home and ended up in Columbus. It was like a huge deal for mom. And so to be able to assist a family in Connecticut and find the family, work with OSU. OSU's like, okay, we're gonna keep him, got him to Twin Valley, got him stable to where he actually gained insight into, oh man, you know what I mean? That was a huge, to me, that was little, but it was also huge, if that makes sense. Because it's like, oh, wow, we heard the happy ending. You know, you don't often hear the happy endings with this. So, yes, I would like to be able to see an increase in the amount of people that we're able to serve. I don't need to hear that, hey, so-and-so's doing better, but that's also nice to just to know that, hey, something followed through and worked out, if that makes sense. Yes, ma'am.
So if there's a call and there's a knife or a gun involved, so it's going to be a potential, it could be dangerous. Do the officers, can the officers say, I don't want a mental health person, I don't want, because then I'd be responsible if something happened to them, even though this could be a schizophrenic, because that's usually where a schizophrenic may pick up a knife. So how does that work?
So the clinicians all have the understanding, and we've been through, like I said, defensive tactics training and stuff. So the officers are already responsible for us. Like, our partner in the car is already 110% responsible for us, our safety, then the safety of the scene, the safety of everybody involved on the scene. So yeah, if it's like an active gun run, as we call it, like, we're either told to stand back or even stay in the car just until they make sure that the scene's safe. And then once the scene's safe, they're like, okay, especially if mental health involved, you know what I mean? Then MCR will go up. But patrol usually responds to those because those require a decent amount of units depending on the situation, if there's like a knife or a gun involved. But yeah, they just kind of have us stand back a little bit until they make sure that the scene's clear and safe for everybody, and then we engage when appropriate, yeah.
And what does when appropriate mean?
So it depends. Like, let's say, I'm trying to think of a scenario like real quick, and I should be able to pull them out after 4 years, but you know, they all run together. If somebody's in a house, so I've been on a lot of, let's say, SWAT barricades. Okay, so you've got somebody who's got hostages in the home, they have the guns, or we hear that there's guns, we're not sure where the guns are. Clinicians, like, I've tried to speak on the phone with people in the house, like, hey, will you talk to me? But there's no way I'm going in that house. You know what I mean? Like, there's no way. So until, again, like SWAT, CPD are able to, like, get the person to safety, you know what I mean? Then we'll try to help talk, you know, sometimes they want to talk to us, sometimes they don't, you know, we don't force ourselves on people. But yeah, so in situations where, you know, like, that's the first one that comes to my mind, like, that's a barricade, we don't know where he's at in the house, we don't know what weapons he has, then definitely clinicians are not going in. We'll try to engage from like the exterior and then go from there. And a lot of times that just ends up going straight with patrol and then like to a hospital or jail, depending on what the circumstances were. But other than that, like, I've been in a lot of homes where there are things of that nature, but if the scene's okay and everything's good, then yeah, we're in there with them and we're engaging and seeing what we can do to help.
I have another question. Noticed at the beginning of your presentation when you got to neighborhood social services, I serve in the Linden area. So I wanted to know, is this supposed to be Linden Anti-Violence Team? And I'm thinking that, why is it just called the Linden Anti-Violence Team when we got violence all over the city? So that just kind of struck a chord with me that all of a sudden, you know, is Linden that bad where we just got to have just a Linden?
No, it's, It's not so much that. So we follow the principles of people, places, and behaviors for anti-violence work. And so sometimes there can be some concentrations of violence. And so what our goal is to start with Linden and then expand. So what we're doing is a lot of piloting, kind of like starting and then scaling up. So we decided to start with Linden. We have some other things that are going on as well. Our One Block at a Time initiative, for example, is an initiative that builds on collective efficacy and really kind of getting to know one block, and then you build up from there. So our goal is to kind of concentrate several of our efforts and initiatives in one space and then continue to build from there.
I think I've had some conversation with you before.
I think so.
Yeah, okay, all right.
Any other questions? Thank you both for joining us this
Thank you.
afternoon. We
Thank you.
appreciate it.
Great job, ladies.
We appreciate.
Keep up the good work.
I do have, if anybody's interested, I have some one-pagers that I could just kind of leave for you guys, and then,
That would be great.
perfect, thank you.
Thank you. All right, next up, we'll have updates from the Inspector General's office.
Good afternoon, Honorable Board. Thank you so much. I hope that everybody had a nice little brief break while we were off for the last couple of months. So I'm going to start off. Yeah, cool. With our agenda, what I want to do today is introduce our board executive assistant. I also want to go over a 7-month recap, which also will include updates for July and August, and then also give you the stats on the investigations and complaints that we've received since we went operational in July and August, and then to end with any questions that the board has. So I want to start off by introducing, and as you can see, she was sitting here before, but this is our new executive assistant for the Civilian Police Review Board, Bethany.
Hey, everyone. You've received emails from me, and I've talked to a few of you briefly. But just a brief overview of my background. I have a bachelor's and associate's degree from Ohio University. From there, I went on to work at State Farm Insurance for about 10 years, customer service, insurance sales, that sort of thing. From there, I went on to work as an administrative associate at the Ohio State University Wexner Medical Center. I provided full administrative support for the division administrator, division director, the section chief, program director, and lead physicians within the Division of General Internal Medicine.
Hold on, Bethany, are you having trouble hearing her? You might need to turn the mic towards, there you go.
Sure. I also was the recruitment coordinator and faculty affairs coordinator for the division. I assisted with the hiring of many physicians, and we opened new clinics in the years I was there. I also was the P-card manager. From there, I went on to work as a human resources director at a new skilled nursing facility in Grove City. I led the hiring of 100-some employees for the new facility. We started from scratch, like 2 residents there, 10 employees, 120 employees by the time I left. I did the benefits enrollment for all new staff, open enrollment for all the staff. I organized and conducted weekly new hire orientations and payroll for the entire facility. From there, I went on to Administrative Associate 4 at Ohio State University. I provided support for the Department Chair of Food, Ag, and Biological Engineering. I took care of all his travel arrangements, post-travel reimbursements. I also provided administrative support between the department and the college through like promotion and tenure, the hiring of the professors and everything. I kept the minutes for our monthly faculty meetings and quarterly industrial professional advisory group meetings. I also did the meetings for that, and P-card manager for that too. So that's it. A little bit of everything.
Well, thank you so much. I really appreciate it. And as you can see, Bethany just jumped right in. I left it up between her and Nate to make a decision as to who was going to be in charge of the meeting, and she just really has jumped aboard. And again, I think a lot of the board members have already started receiving emails from her regarding our outreach program, and so she's amazing. And again, really appreciate, we're so blessed with the staff and the people that have applied and we've hired to be aboard. So thank you again.
Yep, thank you.
What I wanted to do is just really do, and if I go too fast, please let me know. I just really wanted to do just a recap of 7 months of what has occurred as to where we are today with this office. Again, I want to start off by saying I had the just amazing opportunity and thank the board so much for appointing me as your Inspector General in February. And then as you can see, right, hitting the, getting appointed, we went right into work. You can see in the month of August, we were able, not August, March, we were able to, secure our permanent office space. We began looking at different job descriptions. We did our posting for investigators, our executive assistants. Also, the month of March was when I had a chance to attend the AIG training and became a certified Inspector General. Still continuing our community engagement. Coming into the month of April, we hired our Deputy Inspector General. Also started looking at the first quarterly budget for the office. We were able to get our DIG logo, as you can see that's posted. We began ordering equipment for our staff, because not only are we posting for positions for investigators and executive assistant, we also had to make sure everybody was equipped. We went into doing that. Securing some demonstrations for the Matrix Investigator, which is our case management system that we're using now. Conducting interviews. Our interviews were not just in person, they were also virtual. The investigators were also given writing assignments that we had to review. Again, we also had the got some information that we were looking at a community relations coordinator. So again, we started working with HR to create that job description. Then you come about May. May was the first time that I did a podcast for the future of policing and community, just trying to get out there and give the community a little more information about our office. We hired our investigators in May. That's when they came aboard. Also, we secured a contract with the Saunders PR Group. Some of you got some emails today regarding some of the materials, and some of the materials are also posted at the back door. They've been helping us put together some of the materials that we're using for our community outreach. Also are assisting us in the community outreach program. In May, we also had to secure a temporary office space, because not only did we hire investigators, but our permanent space was not ready, so we had to secure a temporary office space in which we're working in right now. We also had to do rental furniture, so we had places for them. We also secured our website, mainline, hotline, again, continuing community engagement so that we were ready for June. When I did the meeting in June, I told you board that we were ready to be operational, because I'm just not one of these people that like to wait, to the last minute to make sure we're operational, so that we can iron out any things that we did not foresee. So the month of June, we began the installation of Matrix Investigator. That's the case management software that we're currently using. Also aggressively training the staff, because now the staff was on board. So we had classes like ABCs of policing. The staff did ride-alongs. They also had a class in Introduction to the Charter, also FOP review. They also had a class in Fourth Amendment search and seizure, along with criminal investigations. And then again, we still did some more interviewing for our executive assistant. The first set of interviews we did early on, we didn't get as good of a selection. So that's kind of why, if there's any question as to why our executive assistants came latter, after the investigators, that was the reason why we had to kind of go back out and do some more posting of some jobs and review some other applicants. Come July the 11th, we were operational. We opened. We began receiving, reviewing, and conducting investigations. Also, at the beginning of July, I want to say a week before we went operational, is when the staff was trained on the system. So we've been using the system aggressively. So also when we hired our first executive assistant to our office, and we also conducted interviews for the executive assistants to the board, which is why the board is just now kind of getting a chance to meet our executive assistant, because the board, we didn't have a meeting in August. Also, again, I just kind of mentioned in July is when we became operational. We're reviewing, receiving complaints, conducting investigations, and still doing the community engagement. This is where we are in August. In August, our deputy inspector attended the AIG Association training and also became a certified inspector general. We, at that point, our executive assistant was hired, and she started working the 1st of August. We were working on our agreement with CPD and the DIG MOU, is our finalized agreement. The agreement allows us to be able to have access to some CPD databases, because in the beginning of July, we went through a process of everything that the investigators needed, from the reports to the body cam footage to anything we were requesting. All of that information, per the chief, all of that information went through IB, IBA. Well, IAB. Oh, okay. IAB. We really appreciate them because it was a lot of information. And so some of the information we did receive we received it slowly, but there was a process. But now with the MOU agreement, a lot of information when it comes to body cam footage, access to reports and other different databases, we have access to that. We've also received some training from CPD. We've met with them, so we have our user ID. There's still some additional databases that we don't have access to, but we will be meeting with CPD monthly to try to see the information that we don't have that we do want, if we can get access to that. Along with the different community outreach events, we have attended a couple of community outreach, passing out materials now that we have that, so that, the community gets to know a little bit more about our office and what we're doing. We also had an opportunity to have some additional training. We got training for implicit bias. We want to thank, that was volunteer training that was done by Dr. Jones. We appreciate that. I think the staff will tell you that it was really good training. We learned quite a bit from that. We had a chance to do a couple of tours, which was good information for us. One of the tours we did was with the Emergency Communication Center. Pretty much every department manager came out and introduced and talked about what the level of service was that they could provide. My whole staff was there. That was really great. It really gave us a lot of information. So as we go forward, when it comes to requesting information, not just 911 recordings, but also understanding the level of information we can get from CAT, the level of information we can get from the radios that the officers have. We also took a tour through CPD's public records, because we understand that's one of the things that we have to provide now if we get a public records request. So we went through there, great information, got some information on different software that we may need if we're going to be redacting different things. So I want to come in and talk a little bit more about the stats now. So in July the 11th was the first, we went operational, so we began receiving complaints. And let me first say, any complaint that comes in, our office triages this, and the citizens will get a response. It doesn't matter what questions you're asking. We want to make sure that we call them and we respond. So as you can see, in July, we ended up with 88 complaints is what we received. I just kind of did a little bit of a breakdown there. I won't go into that. If anybody has any questions, please let me know. But we received 88 complaints. 58 complaints were closed. The question some people may have is, what closes a complaint? We will close a complaint if there's not enough information to make a determination that we can proceed with an investigation. We also will close the complaint if the allegation does not involve police misconduct. But as I stated before, every complaint that we receive, we follow up. So we are calling the citizens to say, hey, do you have some additional information that can help us understand whether or not the allegation involved police misconduct? Can you give us some additional information so we can make a determination if it's enough information for us to actually conduct an investigation? And then sometimes we do get calls for people who want information that's not police-related. People can call us and say, hey, I want to get a police report. How do I do that? So, we just want to make it, we want to make sure that anytime someone files a complaint that we're following up on that.
Could I ask just two quick questions? So first, what would be a complaint that somebody, what's an illustration of a complaint that would go to the IG that doesn't involve police misconduct?
Well, and I'll get into that a little bit too. So what happens is when we opened up, we have a hotline. We also have a main line. So people will call, and on the hotline, they may just call and say, I got involved in an accident. I'm looking for a copy of a police report. That's not, because we investigate misconduct or accessories.
That's not a complaint, that's just an informational.
Absolutely, but because the information comes in on our hotline, and because all of the, the person that takes the intake, that's information that we're receiving, and that's work that we're doing. So everything that we get, we account for in the system. Everything is entered in the system.
Okay. So when when you say 58 complaints closed, that includes that sort of thing?
Absolutely.
Okay. And second, would you remind us if the initial complaint doesn't, come to the threshold level of we just don't have enough evidence, information, do you initiate further inquiry? Joe Jones files a complaint, but they're missing some of the elements that would be necessary to trigger an investigation. Does an investigator from your office call Joe back and say, look, there are 3 other pieces of information we need in order to start an investigation? We need to know the specific badge number or, date of the incident. Do you do that?
Absolutely. Give you an example, we have gotten complaints sometimes where we had a person who was involved. It was a hit, skip, and accident, and they said, the officer responded but didn't complete a report. So that's all they gave us. So we would call back to say, okay, give us the date and the time that the accident occurred. Because if we can get the date and time, that would help us maybe be able to identify who the officer is. And so with that information, then we can kind of go forward to see if, in fact, a accident was, if an accident report was completed. We also had a case, and it may not have been during July, it could have been in August, where we had a person that called and stated that they were pulled over and issued a ticket by an officer. They said CPD officer, but they did not like the officer's demeanor. So initially, when we got the complaint, because they gave us the ticket number, we just initially went on and opened that complaint into an investigation. It just so happened that 2 days later, when the investigator reached out to the complainant said, oh yeah, the ticket I got was not from CPD officer, it was from a state trooper. So again, what I will tell you is complaints that we receive that we don't open up into investigations, those we close and we don't do a report on. But if we get a complaint and based on the information, it's enough to open it into an investigation, and then later on we find through the investigation that the information did not involve an officer, we still do a report. So that will be a report that the board will be getting, and it basically, is going to say what we told you, is that we opened it up based on the information that was given to us that we thought was a CPD officer, but later on, it turned out that it was Ohio State Trooper instead.
And I've got a follow-up to that I think would be helpful. Is it possible in the future when, to be able to break down the differences between complaints received versus, a call, somebody asks, a question, just because it's a little hard to understand what what here constituted a complaint. Like, I know we have 30 complaints open to investigation, so I'm assuming those are actual complaints. But then it talks about 58 complaints closed. I'm unclear whether, how many of that was just, we told them where they, they need to find their local resource and then they hung up versus, there's not enough evidence here and we decided not to pursue this further. So is there a possibility that still documents the work that you and the team of investigators do, but is clear that that was, a hotline question that was not a complaint? Just because I think it can be confusing from the perspective of, well, how many were actual complaints versus, just inquiries?
Absolutely. And so we do have complaints that we get in that are logged in as informational only. So that would be easy to kind of break that down. One of the things I will say is some of the complaints that we get in that may be labeled up under investigation, again, sometimes those get to be a little harder because as we're asking for more information, then we find that it was not enough information. So those might be closed up under another thing, but definitely the ones that come in informational, we would be able to note that.
Inasmuch as this board was constituted to primarily deal with police misconduct, if you had a clear demarcation between, we had 58, but only 10 of them involved anything that we would consider to be misconduct. 48 are other, some other category.
I'd actually like to take that one step further. I would like to see, like here, under excessive use of force, what they were, and the same with the misconduct. That way we can look for patterns. It's great to know there were 27 that were investigating or 3 excessive use of force, but not knowing what they were is troubling to me. I'd like to see that information. A matter of fact, a report every month.
So I will go on to say with the 30 complaints here, we open those into investigations. And out of those investigations that are open, nothing has been closed. We are investigating 3 allegations which are excessive use of force. And we're looking at 27 that are misconduct. Those investigations, when they close, will be coming to the board for the board to review. Those investigations will tell you exactly what the excessive force was, what the allegation is, and the misconduct. All of that will be noted.
And I.J. Hendricks, I know you're going to get here, but none of the open investigations have been completed yet. Is that correct?
Absolutely. We have not closed any investigations yet. So right now, as it stands there for the month of July, just so that the board can kind of see monthly, and I'll still go on, there are 30 complaints that were open into investigations in July. And there are no investigations that were closed.
And Inspector General, when we come back in October, I'll have this, so I'll be looking back at the complaints in July and seeing, where we're at are those still on the books or have they been closed out?
Okay, I'm sorry, I didn't understand your question.
I think that what I would like to see, and actually my question will be, as complaints get cleared out, the ability to see it. So if there's a complaint, we have 30 complaints open in July, and I look back in October and we still have 30 complaints in July, my question might be, Inspector General, why do we still have 30 complaints open in July?
Okay. Well, I can say that we do have 90 days to close our investigations, so a lot of times, one thing I can tell you is we will be aggressively making sure that the investigations are closed within 90 days. And if the investigations are still open, it could be open because there's still additional information that we might be waiting on. But I'll definitely make sure that as I'm doing my updates monthly to the board, that you'll know exactly what cases are still open, what have been closed, and then we'll be, anything that's closed, I'll be still dealing with whoever. I know that I'll just say right now, for the vice chair, that we'll be working on the number of weeks that the board would want to see those reports that we have closed, so that the board will be able to review that, what our recommendations is, and make a decision on to whether or not they, agree with the recommendations or whether they want additional information.
I think Reverend Tatum had a question right after me.
Well, I keep hearing these 30 complaints, but she's got them broken down here, and I think when you come back to this, if she's closed one of the excessive use of force cases, then I think that's all that we would need. And the 27 misconduct, if she's closed 10 of those, then that's all we would need until we get the actual report breaking down those cases.
I agree with you, Pastor.
So, how many of are these all individualized complaints about separate issues, or are there multiple complaints about the same incident? So when we say, well, I don't know what is a complaint versus what's an inquiry, but let's say of the 30 complaints that are open to investigations, are those all about separate incidents, or are those other complaints, alleging excessive use of force or misconduct against a particular officer?
So each of the different 30 complaints are all separate. We have had, I think we have one case and so when we submit that report, it will have both case numbers. We do tend to, when we get the complaint, log it into the system. We have had times where if it's the same day, that we might get multiple complaints involving the same incident. So in that case, we will put it up under one complaint. But if someone calls and it's not consecutive, maybe one day or the next day, later on when we're handling investigation, because we do talk among the group. So we have one case, to the answer to your question, that has 2 complaints. But our goal is when we get the complaint, is to put them up under one case. And what I will also tell you, even if we let's say we had 2 or 3 complaints and they all were the same, the report would still be one report because it's one total investigation. We wouldn't give the board like 5 separate reports on the different complaints. But the complaint would have down there that it involved case number, let's say 1 through 5, it would say complaint 1, complaint 2, complaint 3, all combined up under one report.
Yeah, thank you.
And your software enables you to provide a report to us at the end of the year if an individual officer has had 6 complaints or not.
Well, our software, to answer your question, will allow us to search an officer's name to see how many complaints that we have where that officer has been named.
Of course, we would not know an officer's name, but the question that I'm asking is, at a year-end report, would you be able to provide us with, this year we had 500 misconduct reports, or complaints. But of those 500, there were 100 officers involved, with one officer having 25 complaints and the others having 1 each. Do you understand what I'm saying? It would be extremely helpful if we saw outliers in anybody could file a complaint. And your investigation will find that most of those complaints don't rise to a threshold level of, further inquiry. But if we're seeing that we have a few outliers for officers, will your report, or were you thinking that you would provide us with a report that we'd be able to see we have several officers on the CPD that are having an excessive number of complaints?
Yes, that's part of what we want to do with this software, is to make sure as we're putting the information in that we're able to track. And the software does allow us, when we put the information in, if there's another complaint that has been received involving that same officer, our software does allow us to see that. It actually creates a little bit of a little square for us to say you have this name is attached to another report.
And so your thought would be that when you give us a year-end report, that would be part of the report?
We could definitely do that if that's what the board requests. One thing I will say, part of be our responsibility also, to also make the board aware that there are complaints that we get, and and as we're doing the investigation, sometimes the investigations that we're doing and the allegations, after the investigators has had a chance to review the body cam footage, some of those allegations were false. So I just want to make sure that if we're reporting that to the board, that we not only report the fact that maybe this officer may have had 2 or 3 complaints that came through, but whether or not in the.
Clearly, you'll want to sort them
Right.
and say there were 3 complaints and 2 of them turned out to, or whatever. But it would just be extremely helpful, because I think part of our review function would be to say, do we have some officers that, we're recommending this kind of policy, or a response.
Absolutely, absolutely. No, not a problem.
Actually, you can go on to the next slide for sure.
Okay.
I've already skipped ahead.
Oh, did you?
Myself, but actually,
Yes.
I did want to, I wanted to ask if you could speak to some of the hurdles that you have been experiencing or that the office has been experiencing in working to get these closed out. And I ask this because, we just looked at July and we have no closed cases in July, and we're in September and we're about to go into August and we have 100 et cetera cases here. And I'm just, we did speak earlier, you did speak earlier about some of the issues you were having with getting information and those channels opening up. Does that sort of equate into what we're seeing as far as the ratio to closed cases to the ones that we're getting in, I guess? Does that?
Well, and absolutely. And so before we get into the August, and I'll speak on that now. So one of the main hurdles, because we opened up July the 11th, the main hurdle was the fact that when we had to submit our request had to go through IEB to get all the information that we were looking for. And again, we submitted a letter early on, a month in advance, to the chief of police to say who is the point of contact that you want for us to submit everything through. And so we did have to aggressively submit all of our requests through IEB. Matter of fact, I know I'm going to call DC Weiner out. She is here. She can tell you that her box is probably inundated with a lot of the requests that were coming back from our investigators. So it was a lot, and truly appreciate, because I believe their staff was kind of limited, but they were aggressively handling things. There were other things with the fact that at that time, we did not have our MOU agreement, which is the agreement that we now have with CPD, that didn't give us access to some of the different body cam footage, some of the documents, without it going through public records, without them having to go through public records, get the request, have stuff redacted. I could pretty much tell you a lot of stuff took almost anywhere from 3 to almost a month for us to really get stuff. I don't think it wasn't that they were not working, because we did go over to public records. We did talk with DC Weiner. It was just a lot of what we were having access to, what they could give us to it going through public records. So it was a lot. It was a lot. So what I will say is, come the month of October, you're going to see a lot of cases. What I will share with you, matter of fact, Deputy Chief Blunt is right behind me, is that once we were able to get user access, which was back around the first weekend, I think towards the latter week in August is when we got our user log on our access. We secured a couple of locations, one of the locations being the Jerry Hammond building, for the investigators to be able to go log on and to start reviewing the information. Because part of the issue was is that the building we're in, while it's a temporary location, we are using Wi-Fi. It's not a secure network. So if we're going to review the body cam footage and other CPD sites, we have to be at a secure site. So Jerry Hammond Building was one of the sites that we located. We have worked with them, so we have 3 days in which our investigators can go there, sit in there, review, and log on, and be able to close out. And I say all that to say that last week, I mean, we actually have something like 19 reports that are coming in from our investigators now. Because now that they're able to review the information, now they're able to kind of close. So I think you're going to find that your month of October, you're going to have quite a few reports that are going to be coming in. It won't always look like that, but that was one of the hurdles that we did jump. And again, there's still, yes, go on.
Was that part of the because you referenced an MOU earlier in the presentation, were those details, like the coming to the office so many days a week, was that part of that same kind of package, is working out the details so that investigators could get documents and things?
Well, what I will say is that the working out the agreement was really the fact that we had to make sure that we were abiding by all of the guidelines that are in there as far as accessing for this type of information. We also had to go through some training. So part of going through the training and part of signing the agreement and meeting with CPD was to make sure that if they're going to access information like this, that it is at a secure location. And so that was part of the reason why. And it took a while for the agreement to get signed, but the reason it took a reason for the agreement to get signed, there was just a lot of steps and things that we were working out with I was working out with my attorney, Tierra, also things that, CPD was working out with their attorney to make sure that the agreement was assigned and that we're abided by it. So it took a while, but again, as we're moving forward, the one thing that I'm always excited to say is I remembered when we opened up in July the 11th to where we are now, we're so much further along, and that towards the end of the slide, you'll see I kind of do a thank you, because there were so many departments that participated in this collaboration, part of it being IT. So once we were able to get user log-on access, we all know how IT works. So they were like, yeah, you can get user log-on, but then the permissions and things weren't talking, and we got everything worked out, so.
So at this particular time, there are still materials that the IG does not have access to, that CPD has not yet given the IG permission to have access to, or not?
So there are still one database, and there may be another one, but there's still a couple of databases that we don't have access to. One we will be requesting access to. Another one, I think they were doing an upgrade, so as to why we didn't get access to. And so while we do have access to some databases, some of the access and materials that we're able to pull up is limited also. So again, as we're working through this and information the investigators are looking, if we find that some of the access is limited, we're going to reach back out and kind of ask for that. We have scheduled a meeting. I think everybody's aware of what went on the last week or so with different shootings going on. So I didn't get a chance to meet with the chief, but we are trying to meet with the chief at least monthly. And that really is to be able to look at our processes, to be able to say, hey, we're looking at this, we have access to this, can we get access to such and such as we start doing more and more information. So it is it's learning.
I'm curious about, so if you can speak on the volume
Okay.
over July, then
Okay.
August, how that might be affecting the office. Is anyone feeling, I don't know, this is from my bartending days, anyone feeling like they're in the weeds, or, or do we feel like we staffed accordingly?
Oh, no. So one thing I do want to kind of get into August. So August, as you can see, we ended up with 135 complaints. 99 complaints were closed. 16 are pending. And so what I'll say about the pending complaints, what happens, those are the complaints we get, that we don't have enough information. So we're reaching out to get additional information to make a determination as to whether or not it involves police misconduct or getting information to make sure that we can proceed. So when you see pending, that's what pending is. I'll speak on the fact that we closed 99 complaints. So what happened was when we opened in July, there is a main line that the city had created. And so when you called the main line, it would give you all the different departments that you could contact. So when it gave the Inspector General contact department number, it didn't say anything about what we did. So that is the reason why you see like 99 complaints. I mean, we literally got complaints. If they just wanted to get some information, we ended up with that complaint. Again, we were able to correct that. Again, sometimes it's a learning process. Once we were able to find out what went on with that line, we did talk with the Emergency Communication Center, and they corrected that. So now if someone calls the main line and is transferred to the Inspector General's office, it talks about that we investigate allegations of misconduct and excessive use of force. So that number did decrease. And again, they didn't know. I mean, and neither did we, because at the point when we were getting some of the calls, we had no idea that the main line with the city, we knew what our line was saying, but we had no idea that there was a main line out for the city that was giving us this volume of calls. And again, you know, we make it a point, any call or any hotline message we get, we address it, and that's what we did. Just coming into September. So September, we received 28 complaints. As you can see, 27 hotline, 1 website. 8 complaints were closed. We have 20 that are pending. And, you know, again, we still have 0 complaints that have been, there's no investigations that have been closed yet. What I also will say again, you know, September, these dates is just September the 1st and the 2nd. We also know that this was also a time where things were being very boisterous about the incidents that happened with the city. So just to let you know, we're still trying to go through some of the hotline calls, but the majority of those calls were, they were not pleasant. A lot of it was very racially motivated. A lot of it was just a lot of hate calls. And so again, that's why you see sometimes the volume going up. You know, sometimes certain things that happen in the city, you know, we end up with hotline calls that, again, may not necessarily be conducive to what we're doing, but, you know, we are a public, you know, and so people call and they kind of voice whatever opinion and leave whatever messages. What I will say is, you know, what we make it a point to do is with all of the complaints that we have, we are making sure that we address it. We want to make sure that we're providing the information to the board regarding the complaints that we're getting and then the investigations. And again, as I stated, in October, the board will end up seeing quite a few investigations that we have. I want to go back to the total. So if you're looking at the total stats from the time we opened, which was July the 11th to September the 2nd, we received 251 complaints. Out of that, 165 complaints were closed. There are 50 complaints that were open to investigations right now, so that's how many the office is currently investigating, is 50. We have 36 complaints that are pending. Some of that, again, is just information that we're reaching out and trying to get additional information. We do give the complainants time to get back to us because sometimes when we ask them for information, sometimes it could be give you another example. We do have people that want to file complaints on behalf of somebody else, and they can do that. But if they were not an eyewitness to the incident, we do need to talk to the complainant who was an eyewitness or involved to be able to make a determination as to whether or not the allegation, first of all, occurred, and if it involved police misconduct. So we try to give people the chance to get back to us. So, yes.
Thank you for this and for being able to answer so many questions that were asked. One of the questions I had, a couple things, is it would be helpful in the future, maybe when we go into the larger report, to get a sense of kind of how this compares with other kind of departments of inspector generals in terms of, or other intake kind of agencies that do similar work, just so that we have a little bit of a, obviously you can't compare apples and apples right here, but it would be helpful just so we know, okay, there's a certain percentage of complaints that we receive, and then there's a certain percentage of those that get closed or those that are pending. So it'd be helpful just to know that, just like what maybe the baseline should be, or what your, maybe as a team, what your goals are of saying, hey, we want to make sure that we're closing investigations at this window, or that we're, referring these complaints at this time. So that pattern would be helpful. The other was actually as it relates to the form itself. I believe on the PDF version of the form where someone files a complaint, it makes clear that this form and all of its contents are subject to public records, and that's good and that's helpful. I don't think the web version of it, like online on the actual at least on the mobile, it doesn't include any language that I can immediately identify that says, this form and all of its contents will be subject to public records. So I don't know if there's a possibility to maybe, put that on, that kind of notice on there. I think that would be helpful on that as it relates to that piece.
Is that on the form? Because I thought on our form, it has that on there, but you're saying when you pull it up, it doesn't show you?
Yeah, so on the PDF version of the form, it has it directly on it, right under the subject, but like there's a version where you can just do it on web,
Yeah.
and I didn't see anything as it related to the public records.
Thank
So I
you.
wanted to put that out there as well.
Okay.
IJ Hendricks, you mentioned some of the events of the last couple weeks, and we know that BCI&I is looking into at least one of those. Can you remind us of the process? So we know that your office in the intersection of criminal investigations, like what do you do with a complaint if it comes in and BCI&I is already investigating something for potential criminal action?
Okay, so one thing we do know is that we are not a criminal agency, so we cannot conduct any criminal investigations. And so we are administrative. So what I will say is if we get any complaints, and I believe we did get a complaint in over the weekend involving one of the incidents that happened involving the shooting. So that would be something that I think right now we even kind of reached out to the attorney to kind of speak as to how we would handle that. So we can open the complaint, but what we would do is either put it in active because we may not be able to look at it while the criminal investigation is occurring. And that could be for a lot of reasons, because if we're trying to conduct an investigation as to whether the officer's actions involve misconduct or not, we don't want to interfere with the criminal investigation, because part of an investigation is talking to the people and parties involved, and we don't want to do that if that could hinder the criminal investigation. It also could be gathering information, whether that information is body cam footage, any other video. So we just want to make sure that we're not interfering. So I think right now we're looking at the fact that if we get a complaint, or I would say even if the board voted to initiate that they wanted us to look into something, that we would still open it up, but we would place it inactive until we are able to open that investigation. And then the other thing is sometimes, and we just don't know, we don't know what the criminal investigation that's being conducted, we don't know what the outcome of that criminal investigation would be, because if the criminal investigation decides to prosecute that person, then they would not be any longer on the force, and so therefore I don't know if we would have the need to do an administrative investigation if that person is no longer on the force.
So thank you for that. And as a follow, I think it would be helpful, because I know there's a lot of folks who might look to the Civilian Review Board or look to Department of Inspector General when we see these incidents occur, and just so if we had consistent language or statement. I don't know if your office has put out any statements or anything like that. I know you might have done separate kind of media appearances, but just generally, because I think as a board, this is something that as individual members, it's one thing, but as a board itself, be interested in, so that we have clarification and clarity on what is and what is not coming before the board, or what could come before the board in future matters. And so that lack of clarity, I think, is something that I'd be interested in understanding some more, so that we're able to speak to, what we handle and what we don't handle, and at what times that might happen.
I think as a follow-up, is there a way for us as board members to know which investigations have already been filed by individuals with standing? So if we were to, would we be able to see who filed and what those issues are? Because what I'm thinking of is the board, even if an individual member, we talked about this a couple meetings ago, maybe in June, even if an individual family member or community member didn't have standing or did not file, because there's still a 90-day statute of limitations. So even though BCI&I is investigating, there's still a 90-day statute of limitations for whether it's an individual or the board to decide to ask the IG to investigate something. So would we be able to know what investigations are pending, to know whether, as a board, that is an action that should happen? Or do you see what I'm saying? Like, would board member so-and-so, I'm just going to pick on Reverend Tatum because he's right there, but if Reverend Tatum wants to file, believes that the board should initiate an action, but we don't know if one already has been, is that something that we are able to find out?
Yes, so what I will say is, if the board is interested to see if we have received a complaint regarding anything, yes, what I would tell the board is, especially since we have Bethany is going to be the board secretary, and just your great point of contact, definitely send her an email, and I would actually tell you to go through your chair, is, send the email. Bethany enters a lot of our complaints, so she has the access to search the system to see, so it would be important to know, all the information. We would want to be able to search the information in our system, so we would be able to let you know whether or not we have received that type of complaint.
Okay. And that, just for clarity, because I know we said it a couple meetings ago, that 90 days, you open investigation, you would stay it, for lack of a better term, pending the completion of a criminal investigation, but that 90 days still is in effect for the original complaint being filed.
Okay.
Is that accurate?
And I hope I'm answering your question. I'm answering. So my understanding is, if we open the investigation within that 90 days of the incident occurring, that we would be able to stay or inactive that investigation until the criminal investigation is over. So once the criminal investigation is open, or we make a determination that we want to open that investigation back up and to conduct it, then we would have however many days. So if we opened it and stayed at that day, then when we reopen it to conduct the investigation, then we would have 89 days.
Okay.
So I think that makes sense. I agree. Where is how is that possible in terms of the statutory language, in terms of, because part of it is also open a complaint and then 90 days from that complaint is when it has to close? Is that my understanding?
So my understanding is that we have 90 days to conduct the investigation. So with it being 90 days to conduct the investigation, if we open it and we stay it or make it inactive, there is no investigation part going on. So
90 days from the complaint or 90 days from the incident?
So my understanding is you can file the complaint with our office to investigate it, but it has to have occurred within 90 days. And so,
From the incident?
right.
So just following up on the two previous questions, to take the concrete example of the recent shooting that resulted in a fatality, we don't know as a board if there was a complaint filed by a person who has standing, a family member. So if that say, gets delayed, or somebody here doesn't initiate an inquiry for a month, we then have to vote, of course, and get a quorum to say yes. That a majority of that quorum has to agree that we want to have you initiate. So that might be then a month out from the incident, or more, because, I think we need some kind of a system that will trigger information coming to us, because that 90-day clock is running, you're saying, from the time of the incident, right?
In which to file it, yes. So that
Yeah,
would be.
so we're shortening, I'm sorry, we're shortening that window. So we'll need to have some kind of mechanism here to trigger our board to say, look, we just had a highly publicized event. You guys can do whatever you want to do with it, but we did receive a complaint or we didn't receive a complaint. Now it's up to the board to decide, do we want to direct you to initiate an investigation, or and then you could respond and say, well, I can't. It stayed because there is a criminal investigation occurring. Great, but we've done our part of not having that clock run out on us. Are we communicating?
I believe,
not?
And I think just for clarity, I think there's two 90-day clocks that are happening.
Right,
There's the
there are.
one 90-day clock that is from the date of incident. There's 90 days to actually file a complaint with your office.
Correct.
So that could happen on day 89.
Absolutely.
Clearly, but
Potentially. But then there's also a 90-day clock within your office, because I think it's in your policies and procedures document that references the FOP, that your office is attempting to complete every investigation it starts within 90 days, can get extensions for good cause.
so it potentially could be 180 days, you're saying?
Yes, like I think that we've got two clocks, but the issue that I think I'm interested in is, as a board, knowing if and when we need to be the ones to act, because knowing who has filed what complaints, what already exist, because there's comfort in knowing that we could ask you to initiate something and someone else already has, and then we haven't missed anything. We thought that an event needed an investigation, and so did a family member. But I think the worry is, what about things that maybe the family, whether it's through grief, bereavement, whatever, misses the deadline? How do we know? Like, making sure we're all on the same page so that we know if we need to, at our upcoming meetings, have a discussion. Someone might make a motion. I think I just checked the document, and it's motion, second, and majority of the board votes to start an investigation.
Absolutely.
So is there a reason, just to, again, use the concrete examples that, of the 3 recent shootings, is there something that, because this is a public hearing, that we can't just simply ask? Was there a complaint filed regarding Donovan Lewis?
Right. I mean, you can ask, and we just have to search it in our system. And we would be able to answer that question to let you know whether or not that was.
Because then we would, perhaps, even at this meeting, vote and initiate an action, a request to you and to the office. We would initiate a complaint.
I would think as a board, if there's an officer-involved shooting, that's why we got formed. Why wouldn't we,
Well, that's what we're trying to get, that's what we're trying to get here.
Yes.
So, and I'm so happy we're talking about this, because in my head, the problems would occur if the person is not indicted. That's when the problems would occur, and I'm talking about the citizens, because then the citizens are going to be looking at us saying, hey, what happened with this? So if the person is indicted, then it's going to be okay, I think. But on that side of it, we're talking about the criminal side of it. But if that person isn't indicted and the public feels, oh, here it comes. So that's because I get a lot of questions from friends and family, and they feel like we're on this now. I'm saying, ooh, not so quick. So I think we've got to let it take its course over here. But if it doesn't go where they think it should, based on what they're seeing, that's when the complaints and the problems are going to arise, I think.
Which is, yep, go ahead, Reverend Tatum.
I was getting ready to say, Madam Vice Chair, we need to have a point of order here because a lot of people are speaking who have spoken before. And some folks have not, because I watched Willard have his hand up quite a bit, and he always got spoken over. And we need to make sure we have a point of order here so that every board member gets to have a chance to speak at least one time on something before somebody who's spoken 3 or 4 times just keeps on speaking, because it's very disrespectful, you know. But I just want to say, you know, I think that we're just kicking this can down the road because we're asking for something that has not happened yet, and in all probability will not happen until after the process has taken its course. Like Brother Willard said, you know, over there, it's a lot of this, I've been getting calls left and right from my peers. What are you guys doing about such and such and so-and-so? Or have you heard about so? I said, no, I haven't heard about such and such so-and-so. I said, and that's not how this board works. I said, you know, what I will do, and I think it was either Janet or somebody put out an email not too long ago about how we handle these types of things. By if somebody asks us questions, refer them to her, and then she handles, you know, any type of outgoing correspondence or anything like that. And that's usually what I tell them. I say, until, you know, the chairperson receives something officially and we move forward, and she deems how we move forward in this, I don't really know any more than you know. You know, because people are always trying to pick phrases out of us or pick words from us so that they can chew on them and then go start something. So, you know, we just have to be very careful. And I just hope that we don't become a board that just looks for reasons, you know, to do things when they're not there yet. Because that's not how, if I read the information right, that's not how it works. You know, if we get a complaint, we act on it. You know, but I haven't seen us getting any complaints.
Well, we can initiate.
Well, why would you initiate it when nothing has happened yet? That's what I'm saying. Nothing concrete has happened yet.
Well, something concrete has happened. A person was shot.
Yeah,
and
but
killed.
that's not part of the process.
Well, we're initiating an investigation.
So just to remind folks,
No, I mean, what is it that you
I thought that the
disagree with?
process was to allow the proper policing to take place first and do their investigation. Then if we're not happy with that investigation, then we lodge a complaint.
So part of the problem is that, let's say the BCI&I investigation takes 100 days. If that happens and BCI&I decides there's no indictment that's coming, we have statutorily missed a window.
But if a complaint is lodged from outside of this office in reference to that, the clock starts ticking.
So, yes, but it's paused. So let's say Jason Smith, okay, to not talk about something that might be a pending investigation. Let's say there's an incident and Jason Smith is at the center of it and there's, you know, an officer who's at issue with an excessive use of force. BCI&I opens a complaint. They take, like I said, 100 days and decide not to indict the officer. If we are beyond that 100 days, whether it be our board or Jason Smith's family, then there is no IG investigation that can occur if no complaint has been filed within the original 90. Is that correct?
Yeah, so you're talking about two different timeframes, so I just want to provide some clarity there. The 90 days is to file a complaint, which would get an investigation potentially moving forward. First, there's the information gathering, then a potential investigation. There's no tolling of that timeframe. That's a hard 90-day
Yeah.
timeframe. So it is prudent for the board to, if you hear about something in the media or something comes to your attention, it is prudent of the board to check with the IG to see whether a family member or someone with standing has filed a complaint with the IG, because if they have not, and you're getting close towards the end of that 90-day period, then the board could vote to initiate the complaint with the IG. And, I understand there was some talk about having monthly meetings. A special meeting can always be called exclusively for that type of a vote, as long as.
On day 88.
Right. You could call a special meeting. I mean, the monthly meetings is just what Chair Jackson put in place, but you could have a meeting every week if you wanted to. It'd just have to be a special meeting, and you'd have to put notice out on what the topic of the special meeting was, and you could vote as to whether to initiate the complaint. Once the complaint is filed, if there is an ongoing criminal investigation, or even if there's not, but one then happens within some time frame while the IG is investigating, the phrase that kept popping into my head as I was listening to this conversation is an administrative hold. We keep talking about it, put it on pause, and you don't have to use that phrase, that's just what I came up with. But I know, I'm very familiar with Matrix, both on the prosecutor side and on the civil side, not as much on yours is called investigator side, right?
Right.
But I know the folks who run Matrix, and they're very willing to work with you, and you can create all different types of case statuses. And one of them could be an administrative hold status. And then you can search by that case status, so you'll know how many cases would be on an administrative hold. So it would be very easy if the chair of the board communicated with Bethany to then have the IG check. You could run all cases that are currently in an administrative hold, and you'd be able to very easily figure that out.
So
But-
Pastor, do you understand why this is?
I agree with if we set a certain period of time, once these cases start, if they don't have the investigation concluded by such and such a time, then.
No.
Now, can I finish
Oh, I'm
my,
sorry,
can I finish my sentence, please?
Yeah, sure.
Okay, what I'm saying is, say for instance, right now with the current situation with the young man losing his life, I don't know what day they are on their investigation right now. But say for instance, if we at this board said, if they have not concluded by day such and so, we need to meet to find out whether we want to open an investigation. Because it doesn't have to be day 1, it can be day 88. Am I right?
Oh, right, but you could be more proactive. You don't want to box yourself into a corner and get to a point where you may not be able to get quorum for a vote to initiate a complaint. So, if there's something that's higher profile, or you could always have the chair just periodically check with the IG, weekly, bi-weekly, as to whether something is on an administrative hold.
And I agree with that, Pastor Nathan. I agree with that, so that we don't run out of time. Does anybody know what day we are on now as far as the investigation goes?
I can also say I was a prosecutor for over 20 years. BCI's investigations rarely are going to conclude within that 90-day period for shootings that cause a fatality.
Okay.
Yeah, so I think that's just a helpful, and I think as we think about as a board moving forward about how we want to pursue these types of incidents, that is a course of action that I would like to take. I think the board, I hope we can all do that, because that window, the question I do have as it relates to that piece, which is, would it, at that, let's say, I know we've been talking about specific cases, but let's say not a specific case, but there's incidents where it's potential criminal investigation. Let's say that criminal investigation is then concluded, and then you end the administrative hold and begin the investigation. I mean, at that point, what are you investigating? Like we can speak to the abstract. Are you investigating how the process was followed? Are you then reinvestigating that specific alleged complaint? Because the thought I have is that on one end, day 3, the board could initiate a complaint, and the outcome of a particular investigation comes out, or other circumstances arise within the next that period of time. So does that shift how you all approach a particular case, or it might approach a particular case in the future?
So what we would end up doing, and I hope I'm answering your question, is we would be looking into the actions of the officers to see if his actions violated any CPD policies and procedures. You know, that would always be what our investigation would be. So it would not be investigating the criminal investigation. It would be their actions to see whether or not their actions violated policy and procedure. And I also wanted to just kind of remind the board too, is that part of the policies and procedures that you put in place with my office is that you also give me the ability to initiate cases. So in fact, you know, knowing that there is something that the board is talking about that they are concerned about can also be something that is initiated in my office also.
Thank you.
You would also you could also proceed with excessive use of force. I mean, BCI could find that there is no indictment, and then to follow with Mac's scenario there's no indictment, but we've covered ourselves because we've got the initiated complaint, and then the IG could proceed with misconduct, excessive use of force, even though there wasn't enough to go forth with an indictment.
Right, because the one thing that we do know, and that is, and please correct me if I'm wrong, is that, you know, in the criminal law, it is beyond a reasonable doubt. Our investigations are the preponderance of the evidence. So we look at everything, you know, the officer's actions, we look at policy and procedures and everything, and that is what our investigations would be based on. And the findings that we would have is what we would be presenting to the board for what our recommendation as to what our finding is, and providing the board with enough information so that the board would be able to see what our recommendations are, and the board would either approve or disapprove with, you know, what the investigation is that we would be presenting to you.
And that works hand in hand, because maybe what the officer did is not criminal. He does not need to go to prison, et cetera, and all the things that follow that. However, maybe we should proceed as to, he or she should follow through with what the board, what the citizens voted for, what the board and the IG provide, which could mean he might lose his job, or he might be totally exonerated.
Kind of
So-
Thank you for that. A quick kind of follow-up. Is there thought process about certain cases that are on administrative hold that are maybe high profile, that about some sort of time, you know, and I know you don't want to condense a timeline, you want to take all the time you need for the process, but what I worry about is, you know, case goes on administrative hold, let's say there's a criminal process in BCI or elsewhere, takes it up, that's going to take however long that takes, and then from there, it could be another 90 days before, or whatever the pause was, before the IG's office comes up with before they close their investigation. So is there any thought process there in terms of what you all are, you know, how you all are prioritizing cases that have been on administrative hold for however long?
So right now, we don't have anything on administrative hold, but what I can tell you is that we have looked at that process, and we're thinking about how that process would be efficient and effective. And again, to the point that you're saying, is that we don't want to just open a case and just put it on administrative hold, and then it's sitting there for anywhere from 3-6 months, because then that kind of lose, you know, the ability when we want to get out and investigate. So yes, we're definitely looking at that, and one of the things that I wanted to do was also to be able to reach out to BCI and have a conversation with them, because I have not had a meeting with them since we've been open, but that it will be on my agenda to sit down and have a conversation with them as we go forward on that.
Yeah, just a point of order too. My understanding is BCI conducts investigations, but they don't make the ultimate determination. They prepare a report, and that'll get referred over to the county prosecutor's office, who then would decide whether to put it in front of a grand jury. So there's additional time considerations, and obviously BCI doesn't control the ultimate charging decision.
That's helpful, thank you.
Yeah, so I think what's generating this conversation is the sensitivity to our community, particularly with high-profile cases. So what I'm hearing, there seems to be like 2 or 3 recommendations that are emerging. One is, some kind of a statement that is standard language that I don't know, Mary, if your committee, would work with the IG, but I don't see, oh, there you are. But yeah, some kind of standard language so that the community understands what the role of the IG is and what it isn't, given an investigation, criminal investigation, that there's just standard language, because we're having these meetings in the community, but these high-profile cases blow all that out. It just, folks, I mean, I'm getting I get media calls now, I wasn't getting that before these shootings for months, and now all of a sudden I'm getting media calls. Well, it would be great to have standard language saying, here's how the process works. There is a pause. So I wonder if we could agree to put that together so that we say with the high-profile cases. Second, if we did have something like what Kyle is suggesting, like something that bounces to the fore, this is when we together need to know if a complaint is filed when it's a high-profile case, so that we're not taking another month to let it sit where nothing is being said by the board. The public is sitting there without any kind of information. No, the board has initiated with the IG's office a complaint, but the IG has this on administrative hold because under our ordinance, we must do that in order to, complete the criminal process before we then investigate. But that, especially with these kinds of cases, it's just really important that we be proactive. And that's what I'm kind of, is generating my, where I'm coming from here today. Because I've got, we've got 3 shootings. And I'm on the board. And like Reverend Tatum, I have friends in the community and other pastors, folks calling me, media calling, and I don't know what we're doing. I don't have any answers. Well, it would be just great to be able to say to our community, here's the way the process is working, and the board is doing what we were, what the voters expected the board to do. So I just wonder if we couldn't elevate our high-profile cases to a line item in our board meetings so that we're being very proactive.
I will say that, and I know I emailed the board, part of the process for the month of September, and I know Mary will comment, was the fact that we were beginning our community outreach. And so one of the things that we did do as part of the community outreach, simply because we already had several news medias reaching out, we have a contract now with the PR Saunders Group that is helping with the media. So we did do a couple of, one with Channel 6 News and also with Dispatch, and then we had the town hall on Saturday that was sponsored. So made it a point to reach out and let the community know exactly, what the role is here with the DIG, Department of Inspector General, and along with the Civilian Review Board. And I'm sure that as time goes on, keep your emails open, be mindful. There are several things that we've got coming up that we'll be sending out. Bethany will be sending all of that information out for different members to attend. A couple members already attend one of the groups that we had last week. So we are aggressively getting out there. And Also, I'll mention that, and Mary knows that she's also, we have some material along that the PR Sanders group created that was also sent out to the group that kind of focuses a little bit more on the Civilian Review Board. So again, the Civilian Review Board has some material that they're able to also pass out. And once that's approved, we'll get copies of that, and then we'll have that here. So again, the members here can kind of have something to pass out if people are asking questions. And we do have material too. We've got cards and other things that we can also provide. So as you're out in the community, if you just want to start giving information out to different members about the office, we do have that material available now also.
I think that and thank you for allowing us time to segue throughout before you finished your presentation. But I do think it sounds like it's possible to be able to ask Bethany either before meetings to let us know so that we know at the start of a meeting if something has been filed about high-profile action, so that way we can see if we need to actually do something at that meeting or not, right? To vote and to make sure that we're not unintentionally allowing timeframes to kind of dwindle away.
Absolutely. I would say, the chair or vice chair, please, that would be something to just, email Bethany. She can have that. Once she can have all of that information, she can pull it up. And she would be guided by either the chair or the vice chair as to how you want that information shared. So if that's something that you want her to create an email and send it out and say, it could also tell you whether or not, the case number, when it's been created and things like that. So not a problem. And we can just make it a point if that's something, we can do that anyway, but I want to mention that simply because it may be something that maybe the board, as the chair or vice chair, might receive some information from a board member that they would be concerned about that we may not know about. So that would be something, just let Bethany know, and she would make sure she'll be able to provide that information for you.
Thank you. Does anyone have any other questions before the IG continues her presentation?
Sure.
Go ahead.
So piggybacking on what you said, Rich, maybe, and I'm not trying to create more work for anybody, but maybe a specific pamphlet for those high-profile incidences, explaining in standard language for the public, because just think about it, as much discussion as we have had on that topic, imagine how confusing it might be to the public. And I just want to be legit from the start. And one more thing, I think one of the disconnects between the police and the public is not debriefing after a tragic incident. It's sometimes like, for instance, the shootings, if the person's not indicted, even though a life is taken, we say, well, everything's good over here, but we have to explain it, and people will understand, but we have to tell them. Regardless of what the person has done, all life has value, and all life has equal value. So that's important to me, and I'm so happy, and we're knocking it out the park, by the way, by just talking about it. So I think if we do a good job explaining it, they'll get it, and everything will be fine.
And I think to further delay your presence, but I do think it will be important, about having a statement from the department when these incidents occur, and or the board, because when they do occur, there are statements that happen with elected officials, leadership, all sorts of things, and I think just having a sense of where the board stands, even as a board collective, but certainly the Department of Inspector General would be helpful so that we can refer folks to, a written statement of sort or a press release in the future. Thank you.
Absolutely, not a problem. So my last slide really was just a thank you, because what I wanted to really share with the board is that the success of where we are right now has just came from so many departments. I mean, I won't name all of them, but again, I thank the board, because without the board, there would not be a Department of Inspector General, and we would not be here. We had the city attorney's office that really was so instrumental in helping us get together with our policies and procedures and kind of where we are now. I thank Department of Public Safety simply because when we were working with the Division of Police, IAB, to be able to get all the documents that we needed, doing the walkthrough with the public records, being able to have access to CPD's databases. They helped create the user ID number, finance department. It's just a lot of information, technology. So again, it was just kind of like, would not be here today. You know, as they say, it takes a village, took the whole city, and they were just so much support and to where we are right now. And so really just to give a picture of the team, this is your team. This is who is representing the board. This is your team now of investigators, executive assistants that is here to assist the board and just make us all successful.
Thank you.
Thank you, IJ
And I
Hendricks.
just wanted to say if there were any questions, I took everybody's questions.
I think we covered questions. I would
you
like
so
to
much.
give us about a 10-minute break, though, before we go to our community engagement, so folks can take a few minutes. Normally it'd be 15, but to make sure we stick as close to ending on time as possible, let's be back here at 4:01.
Thank you.
Do we need to take a vote?
Next up on our agenda is an update from the Community Engagement Committee. So we'll turn it over to Board Member Younger.
Okay, thank you. The IG has pretty much covered some of this, but we're really moving at this particular time. I have met a couple of times with IG Hendricks, and in fact, I met with her this morning. The materials have been printed, and maybe this will speak to Pastor Nathan's concerns here. The materials for the IG have been printed, and they're ready to go. And the CRB materials have been printed that we can hand out to some of these, some of the commissions. And we're going to, the Community Engagement Committee is going to have a short meeting. I sent out a text this morning, and we're going to review that. So that's in the process. Bethany has been working with, and Nate, Simon have been working with us, and they're invaluable, have been invaluable in helping with community engagement. At this particular time, we're working with the commissions, the rec centers. We're going to start with the churches and any interesting functions that are coming along. Last Thursday, we had a quick turnaround. We ended up going, the first time that the board went out, we ended up going to the Northeast Area Commission meeting. And the way that it's going to work is Bethany will send out an email to the full board and with a deadline. The full board will have an opportunity to volunteer if they want to go ahead and come to whatever meeting is available. And then she'll forward it to me. I'll pick 2 or 3 members, whatever the situation warrants, and then she will notify with the location and the time. She'll notify those members. And last Thursday, I went, Mr. Blunt went, and the IG went, and it was Mr. McIntosh went also. So we were there, and the Inspector General made a wonderful presentation. Ms. Saunders was there, who is our media consultant. And the presentation was such that she was effective. It wasn't over anybody's head. The people were paying attention. And she was letting them know what was available to them, what they voted for. And they had time to ask questions. So, and I think this was our very first one, and I think that by us going to all the rec center idea was wonderful, and we're going to be hitting those, and I called a few of them myself, and they're very receptive. So by going to all these places and letting them know what it is that we're doing, and the materials that the IG's office printed out, are very succinct, and they answer the questions. And with her explanation as to what we do and the opportunity to answer questions, to ask and have questions answered, I think the community is going to have an idea, a clear idea of what it is that the board does and the IG does. And that's what we're doing at this particular time. So, and if anyone really wants to attend a function and they volunteer, just shoot me a text or an email. I'll make sure you get there. And we've been working on this community engagement. I didn't realize how really important it is until I started getting into it. And it'll evolve. And I think, Ms. Hendricks is going to be hiring a community engagement person because she's just done so much. I mean, she's put this whole office together. I mean, I'm just marveling at what it started from nothing, and it's now just, it's wonderful. So she's going to be hiring a community engagement person if she hasn't already, and so that I can work with that person, and plus. So I'm really pleased with everything I've seen. If there are any questions, just let me know.
We're at the meeting.
at the commission meeting, I'd say, Mac, what do you think, about 20?
Something like that.
Yeah, and people there was a police officer, of course, like, that presented the crime statistics, zoning. There were people who were interested in the community, and they listened, they cared about what was going on. Yeah.
Excuse me, Mary, now, when you said North Area Commission, are you talking about North Linden Area Commission?
No, this was the Northeast Area Commission.
Northeast, okay.
Yes. And we'll be going there. That was our very first one. It was a quick turnaround. In fact, there's probably going to be emails in your email box, because I know Bethany is sending some out. Yeah. That's all I have. VIP and the engagement that we talked about.
I'll repeat what IG Hendricks said. She asked Mary to make sure to mention VIP events.
Oh, you're talking about October, sure. Okay, I didn't know you wanted me to.
While Mary's looking at that, I'll let you know, I was able to also attend an event with Richard, and there were 2 investigators. That was over at the East Market. I forget the day. But that was a pretty nice community turnout. The weather was bad, but folks were really interested. I watched them go up to Richard and the investigators and talk with them about what the IG's office does. So there have been lots of opportunities, so please take Mary up on her offer that if there are events and you have the ability to go by, it's a really nice way to support.
Yeah. And the 2 events that the IG was speaking of, on October 6th, it's a VIP event with board members, mayor, city council, and she's thinking that maybe you should speak to it. She's thinking maybe there'll be a luncheon. You did such a good job. You do it.
I apologize, me and Mary. So this is what we were planning on, because we might not be in our new space until October the 1st. I think it was October the 6th, we talked about doing a VIP for the board. Obviously, you probably would have to kind of stagger, but being able to come see the space, walk through, that's what I wanted to do, invite the mayor and some of city council and some of the other people who were instrumental in helping us get the office up and running, and then keep the October 8-day open. That's a Saturday, so that would be a nice day. We're trying to meet with the media for citizens to be able to say, hey, we're open, talk about it, kind of have some soft things out there. Again, so we're anticipating we'll be in our new space. So if you can just keep those dates available, we'll be sending the information out once we're able to secure that we're in our permanent space by then.
Thank you.
Any other questions for Mary and the engagement subcommittee? No? Okay. Next up on our agenda, and this is really brief, at our last meeting, the board had received a request to co-author a grant. And so that generated the topic of us talking about community organizations and what ways we can and cannot support. So we did speak with the city attorney's office, and I will turn it over to Mr. Tobias.
Chair Jackson kind of briefed me on this issue just prior to her back surgery, and then I think, Brooke, you and I spoke on the phone briefly about it as well. And the question initially was posed as, is it legal for the board to do that? And so I delved into it a little bit deeper, and I think in my response to Brooke, I used the phrase maybe outside your authority as opposed to illegal. And I would stick with that kind of analysis. This was similar to what I've dealt with area commissions and some of the actions that area commissions either want to take or have taken and probably shouldn't have taken, in that I go back to the statute and I look at the language of the statute to see what authority has been granted through the statute. I also, in this instance, looked at the charter as well to see what authority has been granted both in the charter and the statute for the board. And I tried to see whether this type of work would fit into any of the kind of categories or descriptions of the type of authority that's been granted through the charter and the statute. And unfortunately, I just do not see this type of work being considered when the charter and the statute were enacted. So I would say it basically is outside the scope of your authority, or it exceeds the scope of your authority, and the advice would be not to do it.
Thank you. Any questions for Mr. Tobias? No? Okay.
I would
Go
just
ahead.
point, like, you know, if we don't move forward, just to recommend and refer, you know, the organization, you know, future organizations as they try to do this type of work and say, you know, not right fit for us, but, you know, here's other ways we can get the support out there.
Yeah, and just as a reminder, that was specifically about being able to co-write grants, which is what we're not authorized to do. So in the event that it comes up again or somebody receives a request, I think you can let them know that that exceeds our actual authority as a board to be able to join in together to do that work.
And I'd also say, you know, the board and the IG are supposed to be independent. And so once you start kind of getting into that area, you may, not intentionally, but may lose some of that impartiality or independence, so.
Thank you.
Thanks. So for our October meeting, a few things that we know we will be doing. One is I reached out to NACOL because we wanted to have a training on best practices on reviewing investigations and investigations generally. And NACOL does have a shorter module unit. It's about an hour long where they will, I won't say come train us because it'll be virtual. They will participate via Zoom, but will train us with best practices. There is an opportunity to do a longer day-long training, which we may look to do in the future, but since we should soon be receiving completed reports, we thought it was good to get that training done as quickly as possible. So Bethany is working on getting the details for getting a contract and working with NACOL to get that scheduled. So our October meeting will have at least an hour's worth of that sort of training for us as we're getting ready to review reports. We also anticipate, IG Hendricks mentioned all the movement and the reports that are being completed. There might very well be a possibility that we get some completed reports during the month of October or before our October meeting. So timing-wise, it's probably good that we're going to be there. In the interim, though, if you remember a couple of meetings ago, we set up review subcommittees. So all of us, and now that Mr. Thomas has resigned, I'm going to guess, Gambit, that you will no longer have a bye on a review committee, but you'll probably take Mr. Thomas's place. But we have 3 subcommittees of small groups of us who will be reviewing reports. And that's as specific as we've been able to get thus far. So once we know from the IG how many reports are coming in, we'll set up a rotating schedule so that everybody's getting an equal amount of reports to look through, so that it's not just one subcommittee getting everything. Yes, Mr. Tobias.
Those review committees, Chair Jackson previously mentioned to me that those committees may need some guidance in terms of how to read through the reports, what to be looking for in those reports, what do I do with these reports after I've read them. So again, I'm available, our City Attorney's Office is available if any of the review committees need guidance in that regard.
Yeah, in the event that those reports are submitted to the board prior to our training in October that goes over some of these best practices, then we can get in touch with Mr. Tobias in the interim before we actually start making final recommendations on them. So that way, folks, if you've got questions, feel free to ask them. All right, other than that, I believe our normal run of business in October will be our approval of minutes, any update from the IG's office, but I don't anticipate that that's going to be a 3-hour meeting, but who knows? It might be. All right, any other business that anyone would like to put before the board or discuss? Okay, let's go with Reverend Tatum.
I yield to Nate. I just want to, 2 things very briefly. What we discussed in reference to, cases. And I think we need to really revisit that next month, and really discuss that some more and how we would like to handle that situation. And maybe put together some kind of protocol as to how we're going to do that so that we do not run past that 90-day window on certain cases. I think it's important that we revisit that. That's number one. And number two, Brooke, I want to say thank you for that magnificent job that you've done conducting this meeting, in the absence of our chair. I think you've kept us moving, you've kept us productive. I think we got through this meeting, in par excellence.
Thank you, Reverend Tatum.
Yes, I wonder if we would entertain a motion to initiate an investigation. And so I don't know what the process is to know whether a complaint has been filed. But we do have a very high-profile case here, and along with the two other shootings, but I don't know, at least for me, why we would be waiting a month to move to initiate an investigation. So, yes.
Yeah, okay, go for it.
You could just make it conditional. I know that IG Hendricks said she would need to go back and double check, but you could just make a motion, with a conditional motion saying, upon searching, if there's no complaint that's already been initiated regarding that matter, that the board would like to initiate one.
And then, well, okay, you can make it. I was gonna.
Okay, so that we have some specifics for our minutes. So we do have 3 high-profile shootings that have happened over the last 3 weeks. So Mark, if your motion, is it specific to one in particular?
No,
Or all 3?
All three. If there's not been a complaint filed, that we initiate the Inspector General to file the complaint.
I don't know if this discussion, has that a motion officially been on the table yet?
Yes, so
When does
Mark,
the discussion happen?
discussion happens after the second, so Mary already
Mary's already
seconded.
second.
Okay. Discussion.
Yeah, discussion.
So, yeah, sorry, the Robert was, so the one point that I did have is that I think even still, whether or not there has been a complaint, like, it doesn't really matter in terms of whether or not we as a board want to initiate something, right? So, I think that's open. The other piece is that when we mentioned the other, talked about 3 shootings in particular, I know my understanding is that one is not going under BCI, like BCI is not investigating one. And so that, presumably that clock ticks and is moving. So I just wanted to put that one out there that we're talking about. Those are separate. I had some just general questions about kind of how that process was going to work as we initiate, but that is one caveat that I wanted to put out there. But I would be in support of moving forward.
Okay. I'm sorry. I believe we can. If I would,
Make sure that there's language indicating that it's conditional, that if one's already initiated on any of those 3, that you don't need to open up a second complaint.
So we need a specific motion to that effect.
Just using language that it's conditional. I know he was like, I second that, but what I say is not the
That is
motion.
That is the motion that I made, that if there is not a current complaint, that the board initiate the Inspector General to file a complaint. That is the motion, and Mary Younger seconded.
Can we be specific about those 3 cases, though? I think that, if they need to be mentioned, right? We keep going back and forth and stuff, but,
so we've got August 20th. That was the West Side shooting with no BCI&I, correct? I know that, the other 2 I know details. August 27th, there was a 17-year-old who was shot on the east side of Columbus after a traffic stop, and then August 30th, Donovan Lewis was killed. But the first one, that's the 20th, correct?
That is correct.
Okay. So that, Mary, your second still stand with those details?
Yes, my second stands.
Okay, so it's been moved and seconded that the IG open an investigation on all 3 high-profile shooting cases that have happened on August 20th, 27th, and 30th. as long as a case has not already been filed and a complaint filed with the IG's office on those 3 cases.
And just for further discussion, for clarity, right? So let's say, somebody has filed a complaint that is not, that has not met the standards of like, we need some more information here, those types of things. I want to make sure that our motion doesn't, basically we get, like, we're moving forward with a process. There's a way to get there.
You're going to probably be met with the same result, because if somebody's already called and initiated a complaint and there are people who are not forthcoming and not willing to participate, and that's why it got closed, even if you initiate it, they're going to reach out to those same folks to invest. So you're going to probably get to the same result, but
And if I might further the discussion, if in a different situation where we have chosen, because a complaint has been filed, to not initiate a second complaint that Kyle was asking about, let's say they withdraw the complaint. Would it not make sense for us to have initiated a complaint, or is there something else that you're thinking?
I mean, you could always just, cover all your bases and just, regardless of whether it's conditional or not, just ask that it be initiated, and then they get merged together, under one case.
That would feel better.
To cover for that instance, you could certainly do that. The other issue that came up when Mr. Strickland was talking is the 2 types of complaints that I saw you put on your PowerPoint were excessive use of force and misconduct. Those are 2 separate paths, and so the one complaint that may have been filed by the public may have been for excessive force. I don't know whether they're part and parcel of each other or not, and you say, well, make sure we're covering misconduct as well, so.
Yeah. That's, I don't know how the exact process for amendment, but I would, if you're open to it, but I think I'd be in support of just initiating, regardless of whether or not there has been complaints filed, and then the IG's office would then merge if there are multiple complaints.
I'm fine with that.
Mayor, same?
Yes.
Okay. All right, so the motion is now on the table to have the IG initiate investigations on all 3 high-profile shootings, August 20th, 27th, and 30th, and leaving it right there. All in favor, please say aye or show raising of your hand.
Aye.
Any opposed? Any abstentions? Motion carries. We will need to ensure that we get with the correct staff member at the IG's office to complete whatever paperwork is necessary to ensure that that gets started. Okay? All right. Anyone like to move to adjourn?
So moved.
Second, thirds. All in favor, please say aye. Aye. All right, meeting adjourned. Thank you all.
Thank you.